Hello, my name is Dr. Shachar Shimonovich. I'm one of the 4 trauma surgeons at Tel Aviv Sourasky Medical Center, located in the heart of Tel Aviv. We are a part of a national trauma system that consists of what is now 7 level 1 trauma hospitals, including in Jerusalem, 2 of them in Jerusalem, in Beersheba, in the suburbs of Tel Aviv, Sheba and Beilinson, as well as in Rambam up north, as well as smaller local hospitals, level 2 trauma centers. Our colleagues at Wolfson, who see quite a bit of penetrating trauma due to their population, and other smaller hospitals that receive patients as well. I wanted to take a moment and thank you for your interest in our cause. We're trying to change fundamentally the current trauma training in Israel. And that's because the trauma training in Israel is inherently different than the trauma training in the United States. I am an American Israeli. I trained in Brooklyn, New York, at SUNY Downstate Medical Center at Kings County Hospital for my general surgery residency. And then I joined Cooper University Medical Center for a year of trauma fellowship training in surgical critical care, where I learned a lot about how the trauma systems work and how the military trauma systems work as well, because of the close cooperation between Cooper and the military. One of the things that I learned was that there's a large emphasis on surgical capabilities abroad in the trauma system, and that's because the United States has been fortunate to not fight and not have to defend its homeland directly, except for what we know of 9/11 and other terrorism attacks. But Israel is quite different, and the reason Israel is quite different is because while we have forward surgical teams and the ability to do perform life-saving procedures on the field, it's oftentimes much more effective to take the injured forces out of combat and transport them using helicopters to one of the level 1 or level 2 hospitals, which are usually available and nearby and have all of the resources available to treat those patients. Now, what that means is that our civilian surgeons become military surgeons, and the nature of the injuries that we see can change radically. And that's what we saw after the attack of this October 7th massacre. One of the things that we saw was, whereas Tel Aviv is a very safe and a very a nice place to live, with 80-90% blunt traumas, old ladies that fall on buses, construction workers that fall on construction sites, bicycle accidents, etc. Now we're seeing 90% penetrating injuries with shrapnel to the neck, to the head, gunshot wounds, and a very different patient population. And that requires a different kind of mindset and a different kind of training. Fortunately, at Tel Aviv Medical Center, the Sourasky Medical Center, we're able to provide 24-hour coverage with a American-trained trauma surgeon, which has seen a lot of these injuries. But most of our colleagues in the country don't have that luxury. We have, I think, fewer than 30 American-trained trauma surgeons that have gone to American fellowships in the entire country. And so we depend a lot on our general surgery colleagues, colleagues that will do bariatric surgeries or will do hernia surgeries during the day to cover and help treat traumas at night, because we simply can't cover all of the volume 30 days of the month. One of the things that we're hoping to bring about is the ACID course. And I wanted to take a moment and explain a little bit about the ACID course. I think it's a wonderful endeavor. It's a very concise, one-day, and very robust course that's offered by the American College of Surgeons. It's continually updated, and it's currently not available in Israel. It is a course that focuses on the surgeon being able to access any blood vessel, major blood vessel that they need to access to get control of it and save lives in a timely fashion. It's a timed course. It's a cadaver course, meaning that it requires us to obtain fresh frozen cadavers for the participants to partake in. And therefore, it requires quite a bit of coordination and it requires quite a bit of preparation, in addition to the proper training that we need to obtain from our American colleagues. One of the endeavors that had come about after this October 7th attack, and a very gracious one by our colleagues at the Cooper University Medical Center, was to see if we can bring about this asset, the Acute Surgical Skills for Exposure and Trauma course, and bring it to Israel so that we can further train our general surgery colleagues in caring for our soldiers when they come in at any time, when they're flown into the hospital and to any hospital. This has required quite a bit of coordination. It requires a little bit of fundraising for the initial course and then a smaller amount of fundraising for further courses. One of the hurdles is obtaining these fresh frozen cadavers, and it's a hurdle that we've been able to overcome. And then we have to start putting together the course with the appropriate tools that we need, the appropriate surgical instruments. And Cooper has been gracious to offer to come and perform the first course and train the first set of Israeli instructors that will be able to take the course forward and offer this course multiple times a year so that we can train senior residents and eventually junior residents so that everybody in an operating room during a time of crisis is able to take care of the injured soldier or the injured patient that comes in. I think it's an unbelievably worthy cause. I'm very fortunate that the Cooper team has contacted me, and we've contacted my colleague Adam Goldstein of the Wolfson Medical Center, the director of trauma at Wolfson, my colleague Uri Naaman, and we're working very hard on bringing this project to fruition. We hope that you guys would feel as strongly in supporting us in this endeavor and bringing Israeli trauma to where it needs to be. This is the first step, and eventually, with the hope of bringing more Israeli trainees to the United States to train in trauma and continue to bring those skills forward as we move along. Like I said, my name is Shachar Shimonovich. I work at the Tel Aviv Sourasky Medical Center. Please feel free to contact me at any time. We'll make sure that my email is available for anything. And should you have any questions, I'll make sure to be available and available for phone calls or any other questions that I can field. Thank you very much for your interest. We appreciate it. We think that we can really help move the country forward and save a bunch of lives. And that's what we're here for. Thank you very much. Have a great day.